If you're waking up 2, 3, even 5 times every single night just to urinate, let me tell you, that might not be just aging. Hi, I'm Dr. Sarah Bennett. I've been working with older adults for over 20 years, and today I want to share something that could change the way you look at nighttime bathroom trips. Let me start with a question. What if your body has been trying to tell you something and you just haven't known how to listen? A lot of men I meet in my clinic shrug it off. Doc, they say, it's just part of getting older, right? But then I think of Paul. Paul is a 68-year-old former Navy man. Strong, independent, always took pride in taking care of himself. But when he came to me, he looked tired, not just physically, but emotionally drained. I can't sleep anymore, he told me. Every night it's 4 trips to the bathroom. I feel like I never rest. We ran some tests, and the results left us both silent. That seemingly harmless symptom waking up to pee turned out to be a sign of an enlarged prostate, chronic inflammation, and we were lucky we caught it when we did. Now, I don't share Paul's story to scare you. I share it because he's not alone. In fact, millions of men experience this, and many don't know that frequent nighttime urination could be one of the earliest signs of prostate disease, even prostate cancer. I know this might sound alarming, but knowledge is power, and the sooner we understand the signals, the better chance we have of doing something about it. So, in today's video, I'm going to walk you through the real reasons why your body might be waking you up so often at night, and how those trips to the bathroom could be your first warning sign that something deeper is going on. We'll talk about what the prostate actually does, why it changes with age, and how you can tell the difference between something benign and something more serious. Because sometimes it's not just age. It's your body asking for help. And today, I'll show you how to listen. Now, let me tell you more about Paul because his story stayed with me. Paul served in the Navy for over 20 years. He's the kind of man who never complained, always kept himself in great shape, and believed in handling things on his own. But about 6 months ago, something began to change. He started waking up once a night to urinate, then twice, then 4, sometimes even 5 times. At first, he brushed it off. Just part of getting older, he said. But the truth is it wore him down. He couldn't sleep more than a couple of hours at a time. He stopped doing his morning walks. He looked pale, and one day, he nearly fainted in his kitchen from pure exhaustion. That's when his daughter brought him to see me. We did a thorough exam, blood work, a prostate check. The diagnosis? Enlarged prostate, what we call benign prostatic hyperplasia combined with low-grade chronic inflammation. Paul was stunned. He had no pain, no fever, just fatigue and those nightly bathroom trips. And yet, his prostate was pressing against his urethra, preventing his bladder from emptying fully. Each night, as his bladder filled more quickly, it forced him out of bed again and again. But here's the thing, Paul is not alone. In fact, millions of men over 60 are going through the exact same thing, and many don't even realize it's a medical issue. They assume it's just age. But what if it's not? What if your body is waving a red flag and all it needs is for you to finally look up and see it? So what exactly is going on inside the body, inside Paul's body, and perhaps yours too? Let's take a moment to understand the prostate. It's not something most men think about until there's a problem, but the prostate plays a quiet, crucial role in a man's health. The prostate is a small gland, roughly the size of a walnut. It sits just below the bladder and wraps around the urethra-thin tube that carries urine out of the body. Its main job? To produce part of the fluid that nourishes and protects sperm. It's one of those things that works behind the scenes, without much attention until it starts to change. And that change often begins around age 50. For many men, the prostate slowly begins to enlarge, a natural process we call benign prostatic hyperplasia, or BPH. Now, here's why that matters. As the prostate grows, it doesn't have a lot of room to expand. So instead of growing outward, It pushes inward right against the urethra. Imagine trying to drink through a straw that's being squeezed shut in the middle. That's what your bladder has to deal with. At first, you might just notice a weaker stream. Then it may take longer to start urinating. Eventually, you start waking up at night with the uncomfortable urge to go again and again. Even after you've gone, you may still feel like your bladder isn't completely empty. And here's the part that really matters. These symptoms: frequent urination, weak flow, feeling of incomplete emptying gear, often brushed aside as just aging. But sometimes they're not. Because while BPH is common and often benign, these same symptoms can also appear in something far more serious: prostate cancer. And that's the warning I want you to hear today. Prostate cancer often grows silently. In its early stages, it usually doesn't cause pain or discomfort. It just starts by mimicking the symptoms of BPH: a few extra bathroom trips, a weaker stream, maybe some fatigue. That's why paying attention to your body is so important, especially if these changes are new or if they're getting worse over time. You see, most men don't wake up one day with advanced prostate disease. It starts small, subtle, just like Paul. That's why I tell my patients, listen to those signs. Don't ignore them. Because sometimes, the difference between catching something early and missing it entirely is simply the decision to take it seriously. And here's something even more surprising. There's a growing body of research showing that some of the first signs of prostate canceres, even before elevated blood marker scan, be those subtle urinary symptoms we often dismiss. So if you've noticed changes: more frequent urination, especially at night, or any trouble starting or finishing, don't wait. Because the truth is, these symptoms aren't just an inconvenience. They might be your body's first way of saying, something's not right. And when you understand the role of the prostate and how it changes with age, you're better equipped to take control of your health. Now, in just a moment, I want to talk about how to recognize when these symptoms cross the line, when they're not just signs of a normal aging prostate, but potential warning flags that need attention. And I'll also share a surprising nutritional factor that could be making things worse without you even knowing it. So, how do you know when frequent nighttime urination is just a nuisance and when it's something more? That's the question I help my patients answer every single day. Because while getting up once during the night might not be a big deal, waking up 2 or more times night after night, for over a month, that's your body's way of saying, hey, something's off. At first, it might seem harmless. A few extra trips to the bathroom. Maybe you start going to bed earlier to make up for lost sleep. But over time, your quality of life begins to suffer. You feel more tired during the day. Your mood shifts. You stop doing the things you enjoy simply because you're running on empty. And here's where it gets important. That kind of patterned, frequent nighttime urination that lasts for weeks deserves a closer look. Yes, in many cases, it's due to an enlarged prostate. That's common and often treatable. But there are other possibilities too. Sometimes, the cause is inflammation, what we call prostatitis. Other times, it may be a urinary tract infection, or even early signs of a tumor pressing against the urinary tract. These conditions can irritate the bladder, causing it to contract more frequently, especially at night when the body is trying to rest. So, how do you tell the difference? One major clue is whether the symptoms come with other warning signs. Are you feeling pain or a burning sensation when you urinate? Have you noticed blood in your urine? A low-grade fever that lingers? Or do you constantly feel like you haven't fully emptied your bladder after going? These are not just annoying symptoms. They're diagnostic signals. And the sooner we recognize them, the sooner we can do something about it. Another detail I always ask about is urgency. You feel like you have to rush to the bathroom? Like you can't hold it? Do you find yourself planning your day around bathroom access? Or even avoiding outings because of the anxiety it brings? That's when we know it's gone beyond a simple aging issue. That's when it's time to talk to your doctor. And don't worry, you don't need to feel embarrassed. Believe me, I've heard it all. And I can promise you this, you are not alone. In fact, the more we talk openly about these things, the better care we can give ourselves and each other. Now here's something most people don't realize. Did you know that a common vitaminase, something many people take daily, might actually be worsening your nighttime urination? I'll explain exactly which one it is and why the timing of when you take it matters far more than most people think. That's coming up next. Let's talk about something that surprises almost everyone who walks into my office: nutrition. Yes, what you eat and when you take certain supplements can have a real impact on your bladder and prostate health. In fact, 2 common nutrient zones that many older adults take daily could be quietly making your nighttime bathroom trips worse. Let's start with vitamin B6. Now, don't get me wrong, B6 is an essential vitamin. It helps support brain health, metabolism, even mood regulation. But when taken in higher doses, especially as part of certain B-complex supplements, it acts as a natural diuretic. That means it encourages your body to get rid of excess fluids. Normally, that can be helpful, but if you're taking B6 later in the day, it may be pushing your kidneys to work overtimerite when you should be resting. The result? You wake up more often with a full bladder, even if you didn't drink much water before bed. One of my patients, a retired teacher named Sam, told me he'd been waking up 4 times a night for months. When we reviewed his daily routine, it turned out he was taking a high-potency B-complex vitamin with dinner. We simply moved it to the morning, and within a week, he was sleeping through the night again. Now, let's talk about calcium. Many people take calcium in the evening because they've heard it's better absorbed that way, or they're combining it with other nighttime supplements like magnesium or vitamin D. But here's the issue. Calcium plays a role in muscle contraction, and that includes the muscles of the bladder. When taken too late in the day, calcium can reduce bladder contractility, meaning your bladder may not fully empty. That leftover urine builds up faster, especially when you lie down, and soon enough, you're making another trip to the bathroom. It's subtle. It doesn't cause pain, but it disrupts your sleep night after night. The good news? This is something you can control. You don't have to stop taking these nutrients entirely. Often, just adjusting the time you take them can make a big difference. For example, try moving your B-complex vitamins to breakfast time. If you're taking calcium, talk with your doctor or pharmacist about whether a morning or early afternoon dose would be more appropriate for you. These are small changes, simple, really, but they can have a powerful impact. Because the goal here is not just to reduce your bathroom visits, it's to help you reclaim your nights, your energy, and your peace of mind. Coming up next, I'll share a few easy, at-home steps that many of my patients have used to reduce nighttime urination without medication, without invasive procedures, just simple lifestyle shifts that truly work. So what can you do starting tonight to give your bladder a break and finally get the restful sleep you deserve? Let me walk you through a few simple, practical steps that many of my patients have used with real success. These aren't complicated. They don't require expensive treatments or fancy equipment. Just small shifts in your daily habits that can make a big difference over time. First, be mindful of your fluids in the evening. I recommend cutting back on liquids after 7 p.m. You don't have to stop drinking entirely, but reduce the amount, especially water, soups, and other beverages, so your bladder isn't working overtime while you're trying to sleep. Now, here's something people often overlook: salt and caffeine. High-sodium foods like chips, canned soups, cold cuts can pull more water into your bloodstream, which your kidneys then have to filter out. The result? More urine at night. And caffeine found in coffee, tea, chocolate, and even some pain relievers, a known bladder irritant. It can increase urine production and make you feel the urge more often. So if you're having that cup of tea at 5 p.m. or enjoying a salty snack before bed, that could be part of the problem. Try switching to herbal teas without caffeine and enjoy your saltier meals earlier in the day. Another tip that surprises many people is the power of gentle pelvic relaxation exercises. Before bed, take 5 to 10 minutes to do some deep breathing or practice pelvic floor release stretches. These can help calm your nervous system, reduce nighttime overactivity in the bladder, and signal to your body that it's time to rest. Even something as simple as lying on your back with a pillow under your knees or turning slightly onto your side with a small cushion between your thighs can help reduce pressure on the bladder, especially if you're dealing with prostate enlargement. One of my patients, Richard, told me that just changing his sleeping position plus reducing fluids at night helped him go from 4 nighttime trips to just 1. He called it the best sleep I've had in 10 years. The point is, these strategies are easy to try. They don't interfere with medications. They don't cost a thing. And for many men, they're the missing piece they've been searching for. Boutant, this is important if you've tried these home approaches and the problem still isn't improving. If you're still waking up exhausted, still feeling like something just isn't right, then it might be time to take the next step. Because sometimes, no matter how well we take care of ourselves, our bodies still need a closer look. And knowing when to seek help can make all the difference. That's what I'll be talking about next. If you've tried the home steps we just talked about, cutting back on evening fluids, adjusting your supplements, improving your sleep position, and you're still finding yourself up all night, it's time to look deeper. There comes a point when persistent nighttime urination is no longer something you should manage alone. And knowing when to seek medical attention can make all the difference between early intervention and unnecessary complications down the road. So how do you know it's time to see your doctor? Here are a few signs that should never be ignored. If you notice blood in your urine even just once, that's a red flag. If you feel pain or burning while urinating, or if it suddenly becomes difficult to urinate at all, those could signal infection, inflammation, or blockage. And if you're experiencing unexplained fatigue, weight loss, or a general sense that your body just isn't functioning the way it used to, that's worth investigating. These aren't just bothersome symptoms. They're your body's way of whispering something serious, and it's up to you to listen before that whisper turns into a roar. Now, when you do go to the doctor, I want you to feel prepared. There's no need to feel embarrassed. I can't tell you how many men-strong, capable men sit across from me and lower their voices, as if talking about their bladder makes them weak. But it doesn't. In fact, taking charge of your health is one of the strongest things you can do. Here's what I usually recommend to start. First, ask for a PSA test. That's a simple blood test that measures a protein produced by the prostate. Elevated levels can be an early warning sign of prostate issues, including cancer. Next, a prostate ultrasound, a non-invasive scan that gives your doctor a better look at the size and shape of your prostate. This helps determine whether it's enlarged or if there's something more concerning going on. And finally, a urinalysis, that's just a basic urine test, but it can reveal signs of infection, blood, or other abnormalities. These tests are quick, relatively painless, and they give your doctor the information needed to help you take the right steps forward. Now, when you're in that exam room, don't be afraid to speak up. Tell your doctor exactly what you've been experiencing. How many times you wake up at night. How it's affecting your energy, your sleep, even your emotional well-being. You're not being dramatic, you're being proactive. And if it helps, you can even write down your symptoms ahead of time. That way, nothing gets left out. Bring a loved one with you if it makes you feel more supported. But please don't suffer in silence. Because no matter how personal or awkward it might feel, you are not alone. Millions of men are navigating these same challenges every single day. And the sooner you talk to someone about it, the sooner you can begin to feel like yourself again. Coming up, I want to wrap this all together and leave you with one final thought that I hope will stay with you long after this video ends. So let me leave you with this. If you're waking up night after night, tired and frustrated, wondering why your body just won't let you rest, don't rush to blame it on age. Yes, getting older brings changes, but not all of those changes are inevitable. Sometimes your body is speaking up because it needs care, it needs attention, and sometimes it needs help. I've seen far too many good men wait too long brushing off the signs, toughing it out, telling themselves, it's probably nothing. But here's the truth. That probably nothing could be something very real. And the earlier you understand it, the more power you have to change the outcome. You deserve to sleep through the night. You deserve to feel rested, strong, and confident in your body again. And it all starts with listening, really listening to what your body is trying to tell you. So, if you saw yourself in Paul's story, if some of the symptoms I've described feel all too familiar, please don't keep it to yourself. Talk to your doctor, share this video with someone you care about, or leave a comment below and tell me your story. I read every single one. And if you found this video helpful, if it made you feel just a little more seen, a little more understood, then please click like and don't forget to subscribe. There's so much more I want to share with you, because this isn't just about your prostate. It's about your life, your energy, your peace of mind, and you deserve every bit of it. I'm Dr. Sarah Bennett. Thank you for being here with me today. I'll see you in the next video. Until then, take care of yourself and sleep well tonight.